So before there was any talk of vaccination, you had, to your own satisfaction, identified a course of treatment. You were successfully treating thousands of people. You were exporting that idea to those who were listening. What explanation is there for health authorities all around the world, especially in the West, refusing to discuss it, refusing to open that up to public debate and consideration?
Well, Neil, I'm pretty convinced there is an agenda out there. When you come up with the means to negate the mortality and morbidity in a global pandemic, and people choose willingly not to listen, then I'm sure there's some underlying agenda going on. I have a friend in the CDC who became aware of my work in 2020. The CDC contacted me to say they're interested in me presenting to them. But that presentation kept getting deferred till after the rollout of the vaccine. And I was contacted in January 2021 to ask if I would be willing to present, and that as well fell away. So I knew that there was an agenda to push the vaccines prior to any early treatment being acknowledged. My aim was to educate doctors and educate patients about the importance of that 8-day and recognizing a desaturation to get to treatment quickly, which saved all the lives. So it was ranged from patient education to doctor education to understanding the pathophysiology of the illness itself and what to treat. And a lot of the treatment is over the counter, on label. I think the label of viral pneumonia was wrong. So this is a hypersensitivity pneumonitis triggered by spike protein on the 8th day in susceptible individuals. And so everything I did was what doctors should have done from the start: treat the sick first. If we manage to solve all the mortality and morbidity, it completely negates the need for a spike-based vaccine rush to market. Natural immunity was clearly evident from people recovering.
And furthermore, am I right in getting from what you're saying that if it's the spike protein that that susceptible people are really struggling with, that an mRNA vaccine that only makes their bodies produce more spike protein would have been, well, counterproductive, to put it mildly?
Well, counterproductive and I think very poorly designed and ill-conceived. If we are allergic to spike protein, a subset of the population, and it triggers an immune response, an allergic kind of hypersensitivity response, then no manner of vaccine is going to address that issue. It's like someone gets stung with a bee, and we spending our time chasing the bee rather than treating the allergic reaction to the sting. So the virus is really inconsequential. Coronavirus is not the primary pathogen of COVID illness. It is spike protein that triggers a hypersensitivity reaction that results in all the mortality and morbidity. So it's a pathogenic protein that is the primary pathogen of COVID illness and not the virus. But we've spent our time chasing a virus. And of course, we've seen the lack of benefit in doing that globally. Of course, when we deal with an allergic reaction, attempting to expose the patient to that allergen can only bring tolerance. And that's what we're seeing recently with boosting of the vaccine, that we're getting IgG4, which is an immunoglobulin that gets your body to tolerate whatever you're being exposed to. And that's a dangerous thing if your body tolerates an infection with coronavirus. It's going to lead to more severe illness and more prolonged illness because you are not responding to it. And that's where we're at. This was discussed from the early 2021. I made my views on the vaccine very, very well known, that the vaccine will not do what we expect it to do. We are dealing with a severe immune dysregulation, and it should be treated as such. Long COVID has stemmed from that as well.
Dr. Shetty, that's a fascinating account that you've given in such a succinct form that, you know, even I understand that effortlessly. Thank you so much. But time's against us, and I'm going to have to. All I can do now at this moment is just to say thank you so much, and I will very much look forward to picking this story up with you again in the future and hearing more about it. But for now, Dr. Shankara Shetty, thank you very much indeed.